Hello friends. Today I'm going to discuss you with a topic that says heart attack is common in winter. Is it true? Yes, it is true. Why? As you know that in winter there is a lot of dehydration, decreased immunity, and that causes thickening of blood, and that leads to clot formation and patient gets a heart attack. Now, what are the other reasons which cause more heart attack in India? According to me, in winter, people take alcohol, tea, coffee, soup. These all have diuretic effect, means they lead to increased urination and water loss from body. That again leads to uh, thickening of blood and clot formation. That can lead to heart attack. At the same time, because of winter, we don't take adequate liquids, fruit, water, and that this thick blood causes heart attack. The other reason is winter. There are a lot of festivals in India, Diwali, Dashera. In these seasons, we eat lot of oily foods and increased calorie content. We get weight gain is there in our body, and that is a risk factor for heart attack. In winter, people try to smoke heavily and to protect themselves from cold. And smoking leads to plaque rupture, and that can cause a heart attack. Also, in winter, we wear a lot of clothes to protect us from winter. And in that scenario, we invariably decrease exposure to sunlight. Our vitamin D deficiency occurs, and all studies have come up that vitamin D deficiency can lead to heart attack. Also, if you go for morning walk in winter, because of exposure to sudden cold, there is a vasospasm initiated in our body, which can be a triggering factor for heart attack. Also, you might be knowing that in winter we get common cold, flu, infection, allergic lung infections, or allergy for bronchospasm. These all lead to secondary triggering of clot formation in body. Any infection in body or acute reaction in our body can lead to heart attack. Also, sometimes when we are in our room, we keep our room warm with warmer. But as soon as we go out, we are exposed to cold. So if you go out without proper covering, then that can initiate a sympathetic response, which will lead to heart attack. One thing I want to tell you that in India, the northern part of India is having cold temperature compared to the southern part of India. So these things are very much common in northern part of India. But in southern part, because temperatures are not that cold, winter heart attacks are less severe than northern part. In my practice, I have found that heart attack are common due to dehydration of any cause. Like in summer, if there is excessive sweating or you don't take adequate water, then again same principle. Dehydration leads to clot formation, that leads to heart attack. Also, in any kind of infection or nausea, vomiting, loose motion, where you land up with dehydration, that again precipitates heart attack chances in elderly. So if we see overall, if you land up with any kind of dehydration, either because of heat stroke or sudden exposure to cold or loose motion vomiting, then dehydration is a main reason for heart attack. So I will advise how to prevent this thing. The main first thing is that you should hydrate yourself, take adequate liquids, take adequate water, so that your hydration is maintained. Second, do not miss your medicines if you are a heart patient. Third, pick up the warning signs of heart attack, like mentioned in my other videos. So go through them and find out the warning signs of heart attack, like chest pain, dyspnea, and protect yourself from cold by wearing adequate clothing. If you follow all these instructions, then I think then you will prevent yourself from getting an acute heart attack. Friends, share this information with your family and friends and increase their knowledge about heart disease and make them live a healthy life. Thank you. Thank you very much.